Well, a new report out suggests getting tested for prostate cancer may actually be costing you more time, money, and pain than just skipping the screenings altogether. There's a big debate and potentially huge financial implications as a result of all this. And Dr. Sreedhar Potarazu is with us. Vital Spring Technologies joins us now. Dr. P in D.C. with us. I'll tell you, this report came out last week, and since it came out, it's been a lot of discussion on both sides. Some people saying, boy, finally, we're getting what we wanted to hear, that there's too much testing for prostate cancer. And on the other side of it, people saying, boy, this could be very dangerous. But it does have big implications. What's your thoughts on it?
I think it does have big implications. And there's some misleading points that one has to really be cautious about, because the folks that they looked at in this study are those that really didn't have any symptoms at all. The PSA test is still used for those that do have symptoms who are diagnosed with cancer as a marker of progression. So nobody should walk away thinking that the test is going to be discarded completely.
Right.
The second thing is that there is this connection between the PSA test and what they're calling complications, but they've skipped several steps in between. The complications come from if the test is elevated and then you need a biopsy of the prostate, that could lead to complications. It's not directly getting the PSA test itself.
Okay.
Perhaps they should have set more specific criteria around those who really should be getting the biopsy, as opposed to focusing just on those who should be getting the screening test.
Okay, those are all good points, and they're all medical, well, which obviously is the point you're going to make here, Doctor. Those are all medically based points. This is also a big financial story. Do you think, or has it been your experience, that some of the big drug companies kind of working, whether it's in concert with or separate from the doctors, do test too much for certain cancers, whether it be prostate cancer or breast cancer, whatever the case may be? Is there a profit motive here that needs to be uncovered, which is what a lot of people are talking about after this came up?
You know, there could be some element of the profit mode that's been the argument amongst those who are trying to obviously milk the market. You know, there could be an argument that are urologists actually over-testing. The flip side, of course, is in the argument around defensive medicine. When we're not curbing the issues of malpractice, many physicians are going to go ahead and order the test to cover themselves to make sure they don't miss something. So until we until we resolve the issue of medical malpractice, what's going to happen here is if you take away the test and you increase the number of people that may end up getting missed,
right,
there's going to be a big risk for the doctor. So there really is going to be a challenge for physicians today who are not going to get reimbursed now by the insurance companies, who are very well not going to pay for the test in order to do it, but are still compelled to do the right thing when there's a strong element of clinical suspicion to do the test.
So you think there's a big potential loss in store financially for both doctors and, through that at some point, drug companies. Is that fair?
Well, yeah, I think it is fair. I mean, urologists make a lot of money in terms of the PSA test and then the number of people that they're going to end up biopsying. There's no question about it. So if you look at the groups that are responding negatively to this, a lot of the major urology groups in the country are very much against this new draft report because they don't agree based on their clinical practice. But, you know, for the millions of people that end up getting the test, no doctor is going to use the test alone as a means of diagnosing somebody with prostate cancer. I mean, there's nothing more important than the physical exam corroborated with that blood test in terms of determining whether somebody needs to go on to the biopsy. That point is not emphasized enough.
And this story is going to continue. It's a big medical story. It's a big ethical story. It's also, as we've been talking about, a big financial story. Dr. P, thank you very much, sir, for coming on again. We appreciate it.